Hello everyone. In this video, we are going to discuss the last session of the pathogenesis, which is the development and changes of the disease. The development and the changes of disease. This session actually very important for our understanding of the clinical diseases. So if a patient comes to you with certain symptoms and signs, and then after a few days, the symptoms and the signs on the patient may be changed. But these changes, this kind of development, does it develop into a good end, or does it develop into a worse situation? How do you know the prognosis is good or not? That's from the discussion in this session. As this session is very complicated, so we only mentioned some principles here. This session, the development and changes of diseases, we're going to study more in details in the diagnostics. When we talk about the differentiation method, we will introduce that's the flow, the development, the normal development of the pathogens, of the patterns. So here we only going to give you some brief idea. That's the developments of the disease have some principles. They're going to develop according to their characteristics with certain steps. So the first is according to the location. Some disease they can develop from the superficial to internal. They also can develop from internal to superficial. What does it mean is such as the superficial diseases, such as the diseases due to the 6 exogenous factors. These factors are going to affect our health from our nose, from our mouth, or the skin, that's a superficial area. That's why we feel mild fever. We feel aversion to cold or aversion to heat. That's the feeling in the superficial area of your body. And then after a few days, the patient may have diarrhea, poor appetite. So these are the symptoms of the dysfunction, the spleen dysfunction. So as you can see in this process, from the superficial skin, and then after a few days, you see some symptoms of the spleen dysfunction. This is very common in the flu patient. Also, sometimes you can see the flu patient. They have fever, they have aversion to cold, fatigue for the first few days, and then all these symptoms disappeared. It can either from the treatment, from the result of the treatment, or it can disappear automatically. As what happens next is that patient can develop into coughing. That's very common. That's why in the flu patient, runny nose, cough, irritated throat, and fatigue, mild fever, aversion to cold. This kind of patient, they got all these symptoms for the first few days, and then after a few days, the patient develop into coughing, and even they may still have runny nose or not. Doesn't matter they have or not. Also doesn't matter if they have the aversion to cold or not. This reflects in the superficial. Do they still have the pathogens in the superficial area? As from the coughing phlegm, difficulty breathing. These are the symptoms of the lung. So as you can see in this process, the disease develops from the superficial skin and into the internal organs. That's the superficial to internal. So this situation, we can see that the patient, the disease, it become worse and worse. If the patient develop from internal to superficial, that's a good sign of the disease. The patient going to recover in a few days. That's from internal to superficial. If the disease develops from the superficial to internal, it becomes deeper and deeper. The disease is not easy to recover. So that's how we know, just briefly, how we know the development is good or not on specific condition. If the development from superficial to internal, the disease becomes worse. If the development from internal to superficial, the disease is recovering. The second one is the disease due to exogenous factors that can have the principles can according to the meridian's order. This meridian order is actually the order from Sanhan Lun. That's our classic. So this we also going to introduce in the diagnostics in the Zhengjun differentiation method. So it can develop from one meridian to the other meridian, and this flow, such as from yang meridian to yin meridian, it can indicate that the disease become worse. If from yin meridian develops into yang meridian, you can see the disease is recovering. Such as the disease going to start from the Taiyang meridian and then change to the Yangmi meridian, go to Shaoyang meridian. So the patient may have headache, fever, and then after a few days, the patient may have constipation or diarrhea. Something in the abdomen area, that's Yangming. And then the patient may feel fatigue, doesn't want to move. This can develop into yin meridian. So this, if the patient develop into this kinds of flow, you will see that the disease actually become worse and worse. The second is according to the Sanjiao disorder. Sanjiao disorder we have introduced this previously. The Sanjiao refers to upper jaw, middle jaw, and lower jaw. Upper jaw, middle jaw, and lower jaw. Right. So you're going to develop from the upper, middle, and lower. If they develop into this flow, it means the disease become worse and worse. So firstly, the patient have the lungs problem, cough, runny nose because the lung opens in the nose, and fever, aversion to cold. After a few days, the patient have lose appetite and then got diarrhea or constipation. So this you can see the disease develop deeper and deeper from upper to middle to lower jaw. If the disease happens in the other direction, from the lower jaw back to the middle jaw or directly back to the upper jaw, you can see the disease is recovering from after the treatments. According to the 4 levels order, the 4 levels order, the 4 levels we also going to study in the differentiation method. This is actually a new terms for us. The 4 levels refers to Wei levels, Qi levels, Yin level, and blood level. These 4 levels begin to distinguish with the body 4 levels from superficial to deeper and deeper. So this doesn't refer to any organs, but just different qi. Actually, it refers to qi and blood, from qi level to blood level. So if the disease happens from the qi to the blood, which is from this flow way to blood, qi, blood, the disease becomes worse. If the disease develops from blood to qi, you can see that the disease is recovering. So here we just gave you a very brief introduction. If you are interested, you can refer back to your textbook more, and in the diagnostics, we're going to discuss them. The next one is the disorder of 脏腑 organs. The disorder of 脏腑 organs, there are many different disorders of 脏腑 organs among the 脏 organs, between 脏 and 腑 organs, among 腑 organs, between 脏腑 organs and meridians. So as you can see here, all these categories actually refers to all kinds of organs in the body, all kinds of organs and tissues, meridians in the body. That's the multiple disorder of these different. And for the disorder of 脏腑 organs, you can refer back to the 脏腑 relationship when we study the 脏象 theory. Previously, we have 1 or 2 videos that discuss the relationship among different organs. The disorder of these organs are mostly related to those functions, such as the lung and the heart. What's the physiological function of these two? If these two are affected at the same time, it will cause disorder, and then if we have the mutual relationship between these two, the mutual relationship in terms of the symptoms and the pathogenesis. The pathogenesis mostly refers to the causes, and the symptoms also can reflect the cause. So for 脏腑 organs, this session we're also going to study in the diagnostics again, so we're not going to explain here a lot. This is one of the most important parts for our differentiation method for the 脏腑 organs. The development can separate into two. The first is the locations. So that's the information we have discussed just now, from the internal to superficial, or from the different meridians, 三焦, upper jaw, middle jaw, lower jaw, 4 levels, different levels, or different organs in the body. That's the location changes of the disease. The development also can reflect in the nature of disease, such as the heat and coldness. The disease can transform to heat pattern from the cold pattern. It also can transform from the cold pattern to the heat pattern. So these are symptoms that we can see from our clinic. For instance, if a patient with asthma and they cough with clear phlegm, a while the patient may have a fever, or a pressed chest with thick yellow phlegm. And if this happens in one patient in different period, then we will see that the patterns of this patient has changed from the cold pattern to the heat pattern. That's because from the phlegm, from the color of the phlegm from the white to yellow, that indicates from the cold to heat. Also the phlegm from the clear phlegm to the thick phlegm. Also can indicate the cold pattern changed into a heat pattern. So once you notice these symptoms changes, you will know that your treatment should be changed. That's why we can't give any patients the same treatments because the patterns may change according to individuals, also according to different periods of the disease. The pattern also can change from the heat pattern to cold pattern. Such as if someone got hemorrhage such as the internal hemorrhage, the intestine bleeding, so the patient will have blood in the stool and the patient may have hot feeling in the anus, constipation or heaviness that's due to the bleeding, the heat in the body causes bleeding. But after a long term, the patient will develop into blood deficiency, which can cause the cold pattern. That's after a long-term bleeding, the patient will feel fatigue and abdomen pains, or they prefer to be pressed, or they prefer the warm bottles in the abdomen area. Also, the patient may have cold lumps. So this process is from the heat pattern to the cold pattern. So this discussion indicates us that in our treatments, we need to talk with the patient. We need to talk to the patient. We need to see the patient carefully. You can't only see from your textbooks, only from your mind to analyze the process. You have to find the signs and symptoms from the clinical practice and adjust your treatments accordingly. The excess and deficiency patterns also can change from deficiency patterns to excess patterns. It also can change from excess pattern to deficiency pattern. For example, from deficiency patterns, the patients have spleen deficiency, so they have a poor appetite, and also the patient will have loose stool or water retention or dampness that's due to the dysfunction of the spleen. But this dysfunction will cause the pathological products such as dampness, phlegm. Once these products accumulate into a certain volume, it will cause excess pattern, such as water retention. The water retention block in the heart. The patient will have heart attack or chest pain. So in acupuncture, we don't really use those kinds of terms because heart attack is more. You can, but in our diagnostics, we more use the symptoms because it can refer to a broader category. So for instance, the spleen deficiency can cause the accumulation of dampness and phlegm, and this can block the heart or the lung, can cause difficulty breathing, chest pain, these excess patterns. The excess patterns develop into deficiency patterns. The typical symptoms, the typical examples of this is the collapse. So we said yang collapse and yin collapse. Do you still remember? In the pathogenesis, the collapse, it happens in a severe condition. For instance, if someone, due to the pathogens, very violent pathogens and cause the collapse. And after the patient may have unconsciousness, can have high fever, and then after collapse, either young collapse or in collapse, the patient may be fatigued, quiet. It's from excess patterns to deficiency patterns. So for this situation, we need to be careful because this situation is not a good sign. In the treatment, you need to look after the patient well for these deficiency patterns because this might develop into severe conditions. So whenever the reason why we discuss the development and changes here is we want to remind you that the clinical patterns may change in individuals in different period, different course, different period of the course of disease. So during our treatments, especially for severe situation, we need to see the patient quite often to check if the patterns have changed or not. If the pattern have changed, we need to change our treatments, either treatment principles, treatment plans according to the patterns. So you can't use one treatment or one formula, one acupuncture prescriptions from the beginning to the end, because sometimes the patterns may change. We're going to study the changes more in details in the diagnostics. So from here, the last part we're going to mention is the contributing factors of this process. What can affect the changes? What can affect the development of diseases? The first is body constitution. The body constitution can affect the changes of the disease, such as if a very strong body constitution and a weak body constitution. The strong body constitution can recover better, so the development will be less. A weaker body constitution may develop into a more severe situation. The other part of the body constitution is the nature of the body constitution will affect the development of the pathogen, such as the cold body constitution or yang body or the yin body constitution and yang body constitution. The same pathogen go to the body, the pathogen will change according to the constitution of individuals. So this is the example when we study the body constitution. The two glasses of water, one's cold water, the other one's hot water. You put the room temperature water to the cold water, the room temperature is going to change into cold water. You put the room temperature to the hot water, you're going to change to the warm water. So that's the body constitution. Yang constitution is the hot water. Yin constitution is the cold water. The pathogen go to the yang body. The pathogen going to be changed into warm. The pathogen go to the yin constitution. It's going to be changed into cold. That's the contributing factors from the body constitution. The nature of the pathogenic factors. The nature of the pathogenic factors refers to the characteristics of different factors, such as the wind or dampness. They got different characteristics. If we affect from these different kinds of factors, they will have different kinds of development pathways or development trend. That's due to different nature of the pathogenic factors. The next one is the location, the geographic and climatic. Geographic, these two are related because where you live can affect the climate. So this we have mentioned quite a few times it's actually this kinds of thinking apply in the whole study of acupuncture and Chinese medicine. So from the beginning, when we introduced the concept of holism, we introduced the geographic factors and climatic factors. Now, when we talk about the pathogenesis, we also mention these two. That's because different area, different cities may have different climate, also different common pathogens. The last contributing factors is the diet and lifestyle. It can affect such as proper diet, proper lifestyles. These are related to the etiologies of improper diet. So the diet will change your body constitution, such as someone eats a lot of ice cold stuff or raw stuff for long term. Your body constitution going to be changed into inconstitution. The diet going to affect the body constitution, also considered as the factors, contributing factors. The lifestyle, such as the workload, someone exercise or someone that don't exercise, these will affect your health, your body shape, as well as your body constitution. For example, someone that don't exercise, they are more likely to be overweight. And then the overweight is a kind of body constitution, which is a qi deficiency. In this situation, the patient may develop into a worse situation when they become sick. So these are the contributing factors. These contributing factors also tells us in our treatment how many aspects we can interfere from, such as from body constitution, can we do anything from there? The nature of the pathogenic factors, can we do anything from there? From the climate and geographic, can we do anything from there? And the diet and lifestyle, what suggestions do we need to tell the patient they should do in their lifestyle and diet? They need to be careful. So these kinds of theories can border your mind, your way of thinking towards the disease, apart from the herbs or the acupuncture points only. You have a much broader choices to interfere certain disease. Okay, so that's the discussion on the pathogenesis. In the next video, we are going to introduce the prevention, how to prevent diseases, how to keep healthy. Okay, thank you guys.